grad nurse anxiety. Let's talk about it. I had anxiety when I started off as a new nurse. I had anxiety when I switched to the ICU. And so I understand how it feels to go into every shift feeling anxious. When someone tells me that they're anxious before work, one thing that I say is the reason that you're anxious before work is typically because you really care about doing a good job. So the reason you have anxiety is not because you're a bad nurse, it's because you care to be a good nurse. One thing that helps is identifying what are those anxious thoughts that you're having? Are there certain ones that you're having over and over again? Maybe you have the thought of, well, I'm scared I'm going to miss something or I'm scared I'm going to hurt somebody. Okay, if that's your thought, let's think about some tangible things that you can do to prevent that. You're going to write down all the tasks that you have throughout the day. You're going to double check your charting at the end of your shift. You're going to stop before you do anything and think and ask yourself, why am I doing this? What am I doing this for? What's the rationale? Give yourself some tangible things that you can do to counteract your anxiety. I also have to mention that yes, anxiety, having a little anxiety is normal pre-shift, post-shift, throughout your shift. But if you have so much anxiety that it is interfering with your abilities to function at work or in your personal life, this is something that you should talk to a provider about or a therapist about or someone that you trust that can help you navigate your anxiety. Anxiety should get better over time as you get more experience, a little more confidence, a little more, comfortable with the people that you're working with, the environment that you're working with, what your role is as a nurse. If it's not something that's getting better a couple months into your job and you're seeing improvement and you're seeing yourself handle things a little bit better, definitely talk with somebody. Another thing that helped me is telling myself at the end of every single shift, I would, double check everything, double check my charting, make sure I got everything done, give, report to the night shift nurse, ask them if, they had any feedback for me. Once I clock out, I am done for the day. I have done the best that I possibly can do in that 12-hour period to the best of my abilities, and that has to be good enough. Now my role is to go home and live my life and enjoy my life. It is not to carry work with me day to day to day. And yes, that is something that took me a while to learn. And it's something that, over time, I feel like does get easier when you have been a nurse for a while. But those are a couple things that have helped me with anxiety, a couple different perspectives that I have. Hopefully, you found a couple little pearls in here to help you out. And let me know if you have any more questions.